This episode is brought to you by the Solo to Group Practice webinar. It's a free webinar that you can find at practiceoftherapy.com/group, and also brought to you by TherapyNotes, therapynotes.com. This is the Practice of Therapy podcast with Gordon Brewer, helping you to navigate your private practice journey. This is session number 182 of the Practice of Therapy podcast. Hello, folks. I'm Gordon Brewer. Hope you're having a good week or weekend whenever you might be listening to this. Here we are full force into summertime, and I know that it is really feeling like it in East Tennessee. I don't remember when it's been so muggy, but it's welcome to the South. So anyway, I digress. I'm looking forward to you hearing from my guest today, Dr. Manoj, and he is a person that I've met through some collaboration with an organization called Grow Therapy. And one of the things that they do is they enable, in certain states, therapists to get their credentialing through them, and they handle all the filing of claims and all of that sort of thing. So it's a really interesting concept for those of us that might be interested in being on insurance panels. And so I'm looking forward to you hearing my conversation with him and him just explaining the concept. It's really an intriguing concept in that it's a way for people to be on insurance panels without having to go through all the headache. I'm going to let him explain it better than I can. But one of the things I will say is that being on insurance panels is sometimes a tough decision for people. And the main drawback that a lot of us have, although I'm on insurance panels, is just the paperwork involved and all the hoops you have to jump through. But I think as much as anything, the demographics of your area will determine kind of your decision on that, and being able to get clients. Because being on insurance panels is one quick way to get a lot of clients. So anyway, I'm looking forward to you hearing that conversation. One of the things that happened this past week is I held a webinar, and it was using Google Workspace in your private practice was the webinar. And you can still get to see the recording. I've already held the live webinar, but you can go to practiceoftherapy.com/GWS webinar. And you can still get the replay if you haven't done so already. If you've already registered for the webinar, you should check your inbox. You should get the replay of that, along with some information about the bonuses and discounts that I offered in the webinar around the Google Workspace for Therapists course. And if you're interested in finding more out about the course itself, you can go to practiceoftherapy.com/GWS course. And that's the direct link to the Teachable page where the course lives. So I invite you to go over and check that out. So the other thing before we get to Dr. Manoj is be sure and check out our sponsor for the podcast, and that is TherapyNotes. TherapyNotes.com. They are the leading electronic health record system for private practices and private practice owners. They're who I use in my practice, and they are really a wonderful platform. They have a patient portal that is second to none, and also that patients can go in and schedule themselves for your practice if you set it up that way. They also have a telehealth portal there so that you can do it all in one place. It will file insurance claims for you, all of that, and it just adds to the automation and productivity for you in your practice. So be sure and check them out, therapynotes.com, and be sure and use the promo code Gordon, just Gordon, and you can try them out for 2 months without any cost to you. You can try them out 2 months for free. So it's a pretty good deal to check it out, therapynotes.com. And so without further ado, here is my conversation with Dr. Manoj from Grow Therapy. Well, hello, everyone, and welcome again to the podcast. And I'm so happy to have with me today Manoj. He is the person behind Grow Therapy, and I want you to hear about this service. Had a conversation with one of his colleagues about a week or two ago, and just really excited about this new resource for therapists. And so, Manoj, welcome, and glad you're with me.
Thank you, Gordon. Very excited to be here.
Yes. And so as I start with everyone, why don't you tell folks a little bit about your story and how you've landed where you've landed, and we'll take it from there.
That sounds great. A little bit of background on me and my story. I grew up around a lot of mental health professionals, and myself, I was in medical training, and over the past decade or so, I'd found mental health to be something that I really cared about, and found, as I think most listeners on this podcast would know, something that over the past several years, there's been a lot more public conversation about, but in the past there wasn't, and there was a lot of stigma around mental health and sort of seeking out care. And it's been really nice to see that stigma start to reduce, but as that's happened, a lot of folks have been seeking out therapy or seeking out mental health services, and really struggling to find them in a way that sort of fits their needs, particularly financially. So from one end, what I sort of was witnessing was a lot of friends and family were having difficulty finding affordable mental health care, particularly that based on their insurance. And then on the other end, from sort of my personal career path in medical training, it sort of seemed that for healthcare professionals, particularly mental health professionals, the landscape of running a practice was no longer as simple as it might have been a couple decades ago. There were increasing complexities of just running a small business, but then especially plugging into the sort of insurance payment landscape. And it's been that way for a while. And I think a lot of folks would probably agree that it's not it's not that fun to have to figure out how to get on an insurance panel, wait several months to do that. And then once you're in, get reimbursed at a rate that doesn't really sort of fairly value your services that you're offering. And then have to do a bunch of paperwork to sort of get those claims in and then follow through and get paid. So the private practice experience as well just seemed like it was really overwhelming for someone who wanted to run their own practice, and was leading to a lot of clinician and professional burnout. And from that end, I really had always wanted to see a way where healthcare professionals could sort of find that middle balance again, where you have the autonomy of getting to practice on your own terms without feeling like you need a hospital system or a large, like local group practice to have to take care of all the back office for you, but also take away half of your earnings, which was kind of the place where we saw a lot of folks stuck in, where they were getting that support, but they were earning 50 cents on the dollar as a cost for that. So
right,
those two problems were really sort of apparent to me, and were pretty influential to starting our journey on Grow Therapy.
Yes. And I was so excited to hear about it, because you described it perfectly for a lot of folks in private practice, in that I know for me, I'm an insurance-based practice, and part of my decision to do that was for the very reasons you mentioned early on, is being able to provide something that's affordable to people, but at the same time to be able to pay my clinicians a fair wage, but also the demographics of our area. We are a small small metro, it's kind of a small metropolitan area surrounded by a large rural area. And the people that come to us are very dependent on their insurance and need to use their insurance to pay for services. And so navigating all of that, you're right, it's a nightmare. So yeah, I'm so glad that you kind of taken this on. So one of the things that I think folks might be interested in is just kind of how you're structured and how you're different with the way that you do things within growth therapy.
What we saw as options for folks, for mental health professionals were, I guess I'd break it down into a few categories. One would be to, work for a large health system as a mental health counselor, a social worker, psychologist, psychiatrist. Another was to work for a local group practice, and I think that's been a very popular option, and I think will continue to be the case, because it's really nice to have a small group of peers that you can sort of learn from, especially at a certain stage of your career, than to just jump out all on your own. The other is for folks who did feel like they wanted to do their own practice. There are tools like Simple Practice or TherapyNotes that were kind of, do-it-yourself software where you could log your notes, maybe submit a claim, but you just have so much of the work still on your plate to run that business. And then the final one was for people who kind of wanted to plug into the telemental health wave over the past couple of years, and especially over COVID with telehealth companies like BetterHelp or Teladoc. And so that was kind of our assessment of the landscape. And I think just starting from back to first with the telehealth companies, it really felt like those businesses were more focused on the client and not really on the practitioner. And it came at a cost of a lot of mental health professionals feeling like they were just being plugged into a system with even continuity of care being disrupted, where some clients would see someone for a short period of time and then have to be switched to someone else without really much control over that process. The tools like Simple Practice and TherapyNotes, they're great software, but they leave a lot of the practice still in an individual's hand of sort of getting up and running, a lot of the marketing work, getting the actual referrals, and then having to follow up to actually get paid by insurance companies, or even with self-pay. There's some work there. And then we already talked a little bit about the group practice, the pros there. I think some of the challenges before were that with office leases, there was obviously a lot of cost to having to run a local group practice. And for some participating clinicians, that came at a cost to them in terms of earnings. And then the sort of larger health systems, I'd say it's fairly clear that the sense of clinical autonomy is limited there versus in a private practice. So what we really wanted to do was to not be so front facing towards, I guess, clients and sort of branding the experience, but also giving everyone who works with us the support on the back end, so they feel like they don't have to worry about getting paid by insurance companies or having some base source of referrals. So what we've built with growth therapy is, I guess you can think of it as a sort of an infrastructure or a back end for somebody who wants their own private practice to get more support, or for someone who hasn't even started a private practice before. And a lot of folks come to us and they basically have gotten into the stage in their career where they want to take that next step, and they find us as a really good partner to sort of take that leap. So we really strive to offer folks that balance of the clinical autonomy, the marketing and brand independence, but all of the team that's there for you in your corner, without it feeling like an isolating experience.
Right. Yeah, I think it's one of the things that I think is appealing to people is that they're not having to deal with as many of all the different pieces that have to go on behind the scenes. And I think the other thing too that makes you unique is that you do help people with being able to collect from insurance companies. You want to say more about that?
Yeah, absolutely. So effectively, after a visit with our platform, anybody could just just go in and on our software just say, or on our website just say, what the length of that visit was and what the nature of that visit was from a clinical perspective. If you have somewhere you take notes, you can keep it on that platform. If you want to add your note into our system, that's great too, as long as there's something somewhere. And then from there, we offer an estimated time of when somebody can expect it to get paid and how much that would be based on the contract that we have with the insurance company that everyone plugs into. And from there, that's about it. Then our team sort of takes over, submits the actual claim, does all of the follow up to make sure that the claim was cleared, and then checks in with the insurance company to make sure it gets remitted, and then it goes straight to all of our participating practitioners' accounts.
Wow. Yeah. So it's basically when just thinking about the model of business there, the structure, people work as contractors for Grow Therapy. Is that correct?
Right. Yep.
Okay.
That's
Yeah.
the technical relationship. Exactly.
Yeah. Right. So let me see if I've got this correct, and just to help clarify for not only me but maybe some of the listeners, it would be just like if they had gone to work for a group practice where the group practice was credentialed with different insurance companies, and then they contract you. You provide the services, and then the insurance company pays to Grow Therapy, and then you distribute the proportion that the contractor gets back to them.
Yep, exactly. That's
okay.
A structure.
Oh, that's great. That's great. So what states are you in so far? Is because I know it varies from state to state.
Yep.
What the different insurances?
That's a great question. So we started out in Florida, and we built a pretty large community there of close to 350 mental health professionals now. And we have a nice, thriving, supportive online community where folks, get advice from each other on clients, or have peer support groups, or share referrals amongst each other, which is growing really nicely. And we've been excited to see that over the past year. And so now we're really thrilled to share that we're now moving into a handful of other states. And we've been launching in Georgia, the DC, Virginia, Maryland metro area, and Pennsylvania. And that's been some news just over the past month or so. And we're actually excited to start moving into even more states after that. So it's been a lot of work being in touch with the different insurance companies to help expand this platform and this mission into other states. But we're excited to share that we've won over a handful of them in terms of alignment to make things easy for everyone to plug in.
Right. And I know another big benefit of Grow is the community that you have in connection with it, in terms of being able to have conversations with other therapists around clinical issues and that sort of thing. You want to say more about that as far as how that works?
Yeah, absolutely. So anybody who joins Grow Therapy to sort of either build out or help grow their practice gets invited to our online community. And there, it's pretty great. I mean, you basically have the chance to meet hundreds of other folks who have kind of taken the same leap or have been on this journey similar to what you're embarking on, to get to know each other, introduce yourself to them. You can have, one-on-one chats to learn in terms of, I saw your website. I really like the way you were marketing yourself. Can you give me tips on how to build a similar website? Or I just got some referrals for someone on Blue Cross. I'm not accepting Blue Cross yet, would somebody here like to help this person out? They have these specific preferences.
Mm-hmm.
And it's also been really nice to see leaders sort of just grow and autonomously take positions within the community of starting peer support groups around certain topics. And I don't know, it's just, I think it's always a joy to work with with mental health professionals because they're just some of the best people. And
That's yeah, I would agree. Yeah.
yeah, and so the
Uh-huh.
community, it's just kind of flourished on its own, and it's been really nice to just see everyone get to connect with each other.
Right, right. Yeah. So what is the process for somebody that's interested in finding out more, the sign up process and credentialing process and all of that for you guys?
Yeah, so it's a pretty easy process. Obviously, the important thing is whether you're licensed in the states we currently are active in, but that should be expanding pretty soon here. But the real first step is just to go on our website, head over to our providers page, and then just enter in some basic info on yourself, and then someone on our team would schedule an interview or a sort of consult, and just get online and get to know each other and see both from that technical perspective, but just from an individual's like sort of position along their journeys perspective, if that makes sense, whether
Mm-hmm.
there's a good mutual fit. We definitely want to help sort of guide and navigate folks to make sure that growth therapy is a good fit for them, because it's not for everybody, but it is for the folks who are ready to either take that leap into private practice or are already there. So it's really just that first call with someone on our team. And then after that, we kick off the credentialing process.
Right, right. I think it would be just a great opportunity for folks that are, as you kind of alluded to, those folks that might be working for like an agency or maybe a larger organization, but they're thinking about moving into private practice,
Mm,
to be able to use this as kind of a bridge for that, in that they can maybe start a private practice part time or
yeah.
something like that. And then this would take a lot of the administrative stuff off the plate for them in the background. Yeah.
Yeah, you're totally right. And we've seen a lot of people do exactly that, where let's say you work for an agency for, 30, 35 hours a week, maybe 40, and then you have some extra hours throughout the week where you could fit in some sessions, let's say from 5 to 7 p.m., or let's say you have Fridays off and you want to just open up a practice in a really sort of easy way to get a feel for it. And then we've also seen folks who have done that sort of fill up their practice and then start to say, hey, I need to open up more time. And it's fully in their court to set their schedule. We have
Mm-hmm.
nothing to say about that. So as you sort of get your legs under you, you can sort of start expanding and allocating more time to your private practice. So it's a great bridge for folks who are just exactly in that category, as well as
Right.
those who are already going.
Right, right. Yeah, I love that. The other thing, one question that comes to mind for me, that some people might be curious about, and I know it varies from state to state and also insurance company to insurance company. But if somebody's maybe has an associate license, or some places they're called temporary licenses, where they're kind of in that place from they've graduated, they have their degree, and they're working towards licensure. Are you finding that there are some insurance companies that are working with those folks that are under supervision, that sort of thing?
That's a great question. You're totally right. It varies from insurance company to insurance company. So it'd be a little tough for me to sort of make a broad sweeping statement there. A number of companies that we work with they do require upfront for credentialing there to be, a license already in place. So I guess it does vary. And I think as we're expanding to new states, we might see some different permutations of that. But the ones that we'd previously been working with, it seemed like they had a relatively hard line on that.
Right. Are there any this this might be putting you on the spot, but are you finding that there are any states that it's a little bit easier process than other states?
Um, I think it really, even within the state, it varies based on
Mm-hmm.
the region, because the way the insurance companies think is based on their network. And so they break down the country state to state, but then they also break down the country, the state into, the different regions and zip codes, if you will.
Mm-hmm.
But depending on what their needs are for those different areas, they can make it easier or harder for people to join the network. I think
Mm-hmm.
what a lot of the insurance companies are really struggling with over the past year, though, is okay, we've seen that mental and behavioral health has made a really nice transition to tele-based care. And that sort of dissolves their prior framework where they were so focused on local regions. And
Mm-hmm.
I'm witnessing it now. They're actively having to think about how do we adapt to a future that doesn't have such local ties for mental health, or I mean, in terms of what's possible. And
Right.
so I think they're having to rethink that, and we've seen that with a couple companies. So I
Yeah.
think the landscape's changing quickly.
Yeah. I would agree. I think one of the things that we learned just through COVID is that we, particularly with telehealth, is that it broadens our um, really opens up the potential for our clients
Yep.
because you not only have your local region that you service, but you could potentially service a whole state.
Right.
And so being able to think about that kind of marketing, we recently redid our website around the first of the year,
Mm-hmm.
just did a complete overhaul. And the person I was working with, Daniel Fava, I told him, I said, we've got to think about our SEO on a state level rather than just a local level
Yep.
at this point. So again, and I know well, with I'm sure that's something that's on your radar as well as just SEO and making sure that people's names come up in Google searches and that kind of thing when they're searching for therapists.
Yeah, absolutely. Because even though we don't, take the brand for any of our providers, they keep their own brand. We do like to help give them referrals, and that's something that they really appreciate from us. So that's important for us to think about and optimize for them.
Yeah, that's great. Well, Manoj, I think there's probably just lots more we could talk about, but I want to be respectful of your time. Tell folks how they can get in touch with you and where the website and all that.
Yeah, absolutely. So you could just go to growtherapy.com/providers. And that's GROW therapy.com/providers. And that'll give you everything you need to get in touch with us. And we look forward to hearing from everybody.
That's great. That's great. And we'll have, of course, links in the show notes and the show summary for everyone. Well, I'm sure people will be hearing more from you, Manoj, and I'm looking forward to hopefully doing this again. Well, folks, I hope you enjoyed my conversation with Dr. Manoj. One of the things in just doing a lot of the collaboration I do with different organizations and different businesses is I get to meet some really cool people. And one of the things that I'm looking forward to is Grow Therapy has asked me to lead one of their community AMAs, Ask Me Anything sessions, and that's going to be coming up in a few weeks, and I'm looking forward to that. I probably ought to do a podcast on what I talk about, and that is just about having a podcast. They had asked me to come and talk to their community about how to start a podcast and why you would want one for your practice. So just thinking back on my conversation with Dr. Manoj is just being able to network in those ways. And I think that's one of the things that is pretty cool about their platform is that they not only provide a service of being able to file insurance claims for you, but also created a community to build businesses. So be sure and check them out, growtherapy.com/providers. And you can find out more about them. They're really love, as I said at the beginning, love this concept, and also just love the fact that they're creating out-of-the-box ways of thinking about running a private practice, and I think might be a good fit for some people. So anyway, be sure and check them out. And also be sure, if you haven't done so already, register for the Using Google Workspace for Private Practice webinar, and it'll be available until June the 20th. So you've just got, as this episode's coming out, just about a week left before that webinar will no longer be available. So be sure and take advantage of that. And you can get to that by going to practiceoftherapy.com/GWS webinar. And I enjoyed doing it. We've had well over 200 people register for it so far, and we had a great showing at the live webinar. But what you would get now is the replay of that, and so you can watch it at your leisure as long as it's available. It's only, like I said, it's only going to be available till June 20th, so take advantage of that. And as always, the big thanks to TherapyNotes, therapynotes.com, for sponsoring the podcast. They are the leading electronic health record system for mental health providers in private practice. They are who I use in my practice, and really love the platform they've created and the tools that it provides. And also, speaking of tools and things, they also have support that is second to none. When you call them up to get a question answered, they respond to you immediately, and have just tons of tools and blog posts and information about running a practice on the back end as well. So be sure and check them out, therapynotes.com, and use the coupon code, or the promo code rather, Gordon, just GORDON, to get 2 months free of their services. So thanks, folks, again for joining me for this particular episode. I'm really excited about some upcoming episodes. I've got interviewed some people earlier this week, and it was just I'm excited for you to hear from them and my conversations with them just around these different topics. And, as a side note here, if there's a particular topic that you would like to hear more about, just in this private practice space, give me a shout out. Just email me at Gordon at practiceoftherapy.com, and give me your suggestions, because I'd love to hear from you. Or if you feel like you've got a topic that our listeners would be interested in, you can apply to be on the podcast. I get a ton of requests. Not everyone makes it onto the podcast, but if I feel like it's relevant and relevant to our niche, I will certainly send you an invitation to be on the podcast. And you can just go to the website, practiceoftherapy.com, and you'll see links there for the podcast. And if you'll scroll down on that page, you'll see the application, be a podcast guest. And you just fill out that Google form, and it will notify me, and I'll look at it and see what you have to offer. But anyway, hope that too, even if you're just enjoying listening, I hope that you'll be sure and take time to subscribe to the podcast, and also leave us a review and a rating. That only helps for other people being able to find us. This podcast is just growing immensely over this last year. And, we're, for some it might be a small number, but for me it's pretty huge, is getting over 5,000 downloads a month of the podcast. So thank you all for listening in. That's a lot of listeners. But thank you for being with me on this journey. Take care, folks, and we'll talk to you next week. You have been listening to the Practice of Therapy podcast with Gordon Brewer. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. And if you haven't done so already, please sign up to receive the free private practice startup guide at practiceoftherapy.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the hosts, guests, or producers are rendering legal, accounting, or clinical advice. If you need a professional, you should find the right person for that.